Hey everyone, and a massive welcome to our channel. My name is Rahul Arora, and I'm thrilled you're here. Today, we're diving into a topic that is genuinely a matter of life and death, the updated 2025 CPR guidelines and the 5 golden rules you absolutely need to know to save a life. Cardiopulmonary resuscitation, or CPR, is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or even triple chances of survival after cardiac arrest. Knowing these steps isn't just about acquiring a skill, it's about empowering yourself to make a critical difference when seconds count. We're going to break down these guidelines so they're easy to understand and remember, because you never know when you might be called upon to be a hero. The 2025 guidelines, like all updates, refine our approach based on the latest research, aiming to make CPR more effective and accessible. Think of it like updating the software on your phone. These new protocols ensure we're using the most current evidence-based techniques to give someone the best possible chance. We'll walk through each of the 5 golden rules step by step, explaining not just to do, but you're doing it. Understanding the science behind these actions can make you more confident and effective in a high-stress situation. We want to demystify CPR and show you that with the right knowledge, anyone can take action. Our goal today is to equip you with the confidence and the know-how to act decisively. We'll cover everything from initially assessing the situation to performing high-quality chest compressions and using an AED. By the end of this video, you'll have a clear understanding of these 5 crucial rules that form the backbone of effective CPR. This knowledge is invaluable, a true superpower you can carry with you. So grab a notepad, get comfortable, and let's get started on this journey to becoming a potential lifesaver. Remember, the life you save could be someone you love. All right, let's jump straight into our first golden rule. Always, and I mean check if the person is responsive before you do anything else. This might sound basic, but it's a critical first step to ensure you're intervening appropriately. You don't want to start CPR on someone who's just sleeping deeply or perhaps fainted and is now coming around. So, how do you do this effectively? Approach the person, making sure the scene is safe for you first. We'll touch more on that. Then firmly tap them on the shoulder. Don't be timid here, it needs to be a noticeable tap. As you're tapping, shout clearly and loudly, "Are you okay? Can you hear me?" You're looking for any sign of response movement, eye-opening, a verbal answer, even a groan. This initial check helps determine if they are truly unconscious and in need of immediate help. Now, what are you looking for, or rather looking for? If the person stirs, opens their eyes, or makes any sound, they are responsive. In this case, CPR is not needed. You would then try to find out what's wrong, monitor them, and call for help if they seem unwell or confused. However, if there's absolutely no response, no movement, no sound, nothing, then you must assume they are unresponsive and could be in cardiac arrest. It's crucial to differentiate this from someone just asleep. A truly unresponsive person will not react to your loud call or the firm tap. This lack of response is your green light to move to the next critical steps. Remember, we're trying to ascertain if their brain is receiving enough oxygen to maintain consciousness. Before you even reach the person, quickly scan your surroundings. Is there any immediate danger to you? Spilled chemicals, live wires, unstable structures, or oncoming traffic? Your safety is paramount. You can't help anyone if you become a victim yourself. So, a quick scene check, safety check is vital. Once you've confirmed it's safe to approach, then proceed with the tap and shout method. This isn't about gentle nudging, it's a deliberate action to elicit a response. The information you gather in these first few seconds is vital and dictates the entire course of your actions. This simple check prevents unnecessary interventions and ensures help is directed correctly. So, you've checked for responsiveness and there's none. The person is unconscious. What's next? This brings us to our second golden rule, which is absolutely non-negotiable. Call for emergency help immediately. In most places, this means dialing 911, 999, 112 or your local emergency number. Time is incredibly critical in a cardiac arrest situation. Every minute that passes without advanced medical care significantly decreases the chances of survival. Professional help brings advanced equipment, medications, and expertise that you as a bystander simply don't have. Your role is to bridge that gap until they arrive, but you need to get them on their way as fast as humanly possible. Don't delay this step, thinking you can handle it alone. or that someone else might have already called. You need to be certain. If there are other people around, point directly at one person and tell them clearly, "You in the blue shirt, call 911 or your local emergency number now and tell them we have an unresponsive adult." Come back and tell me what they say. If an AED is nearby, ask them to bring that too. Delegating is key in a team situation. If you're alone, use your mobile phone. Put it on speakerphone next to the person so you can communicate with the dispatcher while starting the next steps, like chest compressions. The emergency dispatcher is a crucial ally. They can guide you through CPR, ask important questions, and provide reassurance. Do not hang up until they tell you to. They are your lifeline to the emergency services. When you call, be prepared to give clear and concise information. They'll likely ask for your location. Be as specific as possible, including street address, landmarks, or floor number. Tell them what happened, that the person is unresponsive and not breathing normally or only gasping. Answer all their questions calmly. Remember, by making this call, you're activating the entire emergency medical system. Paramedics are dispatched and the chain of survival is set in motion. This call is not just a request for help, it's an integral part of the resuscitation process. The sooner they are en route, the better the potential outcome for the person you're trying to help. Once help is on the way, we move to the third and perhaps most physically demanding golden rule. Begin chest compressions. High-quality chest compressions are the cornerstone of CPR. You are essentially taking over the function of the heart, manually pumping blood to the brain and other vital organs. To do this effectively, proper technique is crucial. First, position the person on their back on a firm, flat surface. If they're on a soft bed, carefully move them to the floor if possible. Kneel beside their chest. Place the heel of one hand on the center of their chest, right between the nipples. Place your other hand on top of the first, interlacing your fingers or keeping them extended to help keep them off the chest. Keep your arms straight and position your shoulders directly over your hands. This allows you to use your body weight, not just your arm muscles, to compress. Now for the action, push hard and push fast. What does hard mean? For an adult, you need to compress the chest at least 2 inches or 5 centimeters deep, but not more than 2.4 inches, 6 centimeters. This might feel like a lot, and it is, but it's necessary to adequately squeeze the heart. What about fast? The recommended rate is 100 to 120 compressions per minute. A great way to keep this rhythm is to think of the beat of songs like "Stayin' Alive" by the Bee Gees or "Another One Bites the Dust" by Queen, though maybe stick to "Stayin' Alive" for the positive vibes. Equally important as pushing down is allowing the chest to fully recoil or return to its normal position after each compression. This allows the heart to refill with blood. Don't lean on the chest between compressions. Many people worry about causing harm, like breaking ribs. While rib fractures can happen, especially in older adults, it's important to remember that this is a life or death situation. A broken rib is treatable. A brain without oxygen for several minutes is not. Effective chest compressions keep oxygenated blood flowing to the brain, buying precious time until an AED can be used or advanced medical help arrives. If you're not trained in rescue breaths, or if you're unwilling or unable to give them, continuous chest compressions, hands-only CPR, are still incredibly beneficial. Doing something is always better than doing nothing. Your compressions are their lifeline. Our fourth golden rule involves providing rescue breaths, but there's a very important qualifier here: if trained, willing, and able. For many years, CPR was taught as compressions breaths. However, research has shown that for adult cardiac arrest, high-quality chest compressions are the most critical component, especially in the initial minutes. If you are trained in CPR and feel comfortable doing so, the guideline is to give 2 rescue breaths after every 30 chest compressions. To give effective rescue breaths, you first need to open the airway. The most common method is the head tilt chin lift maneuver. Place one hand on their forehead and gently tilt their head back. With your other hand, use your fingertips to lift the chin. This action lifts the tongue away from the back of the throat, clearing the airway. Once the airway is open, you'll deliver the breaths. Pinch the person's nose shut with the hand that's on their forehead. Take a normal breath, not a deep gasp, and make a complete seal over the person's mouth with your mouth. Give a breath for about 1 second, just enough to make the chest visibly rise. Watch their chest. If it rises, you know air is going in. If it doesn't, reposition the head and try again. After the first breath, remove your mouth, allow their chest to fall, take another normal breath yourself, and then deliver the second rescue breath, again for about 1 second, making the chest rise. The entire process of delivering 2 breaths should ideally take less than 10 seconds, minimizing interruption to chest compressions. The purpose of rescue breaths is to provide oxygen to the lungs, which then gets circulated by your chest compressions. While compressions circulate existing oxygen, breaths replenish it. However, if you're not trained, or if you're hesitant for any reason, like concerns about infectious diseases, though the risk is very low, especially with a barrier device, then hands-only CPR, continuous chest compressions, is the recommended approach for adult victims. The key is to not delay or interrupt chest compressions significantly. So it's 30 compressions, then 2 quick breaths if you're doing them, and right back to compressions. This 30 to 2 cycle continues until help arrives, an AED is ready, or the person starts to show signs of life. This brings us to our 5th and final golden rule. If an automated external defibrillator or AED is available, use it as soon as possible. An AED is a sophisticated yet easy-to-use medical device that can analyze the heart's rhythm and, if necessary, deliver an electrical shock, known as defibrillation, to help the heart re-establish an effective rhythm. For certain types of cardiac arrest, often caused by chaotic electrical activity in the heart, like ventricular fibrillation, an AED is the thing that can restore a normal heartbeat. Chest compressions keep the brain alive, but an AED can potentially fix the underlying problem. That's why getting an AED to the person quickly is so vital. Many public places like airports, malls, gyms, and schools now have them. Using an AED might seem daunting, but they are designed for lay people with minimal training. As soon as the AED arrives, turn it on. The device will then guide you with clear, calm voice prompts and often visual instructions. Open the person's shirt and wipe their chest dry if it's wet. Attach the electrode pads to the bare chest as shown on the pad packaging or the device itself. Usually one pad on the upper right side of the chest and the other on the lower left side below the armpit. Once the pads are in place, the AED will typically instruct you to stop CPR and do not touch the patient. Analyzing heart rhythm. It's crucial that no one is touching the person during analysis or if a shock is delivered to prevent accidental shock to a rescuer. If the AED determines a shock is needed, it will tell you to stand clear and then instruct you to press the shock button after the shock is delivered, or if the AED determines no shock is needed, it will usually tell you to resume CPR immediately, starting with chest compressions. The AED will continue to monitor and reanalyze the heart rhythm every couple of minutes. Just keep following its prompts. Early use of an AED combined with high-quality CPR provides the best chance of survival from sudden cardiac arrest. So, if someone collapses, send someone to call for emergency services and to find an AED while you start CPR. These devices are true lifesavers. So there you have it. The 2025 CPR guidelines distilled into 5 golden rules. Check for responsiveness, call for help, start chest compressions, provide rescue breaths if trained, use an AED. Mastering these steps can empower you to take decisive, life-saving action in a critical emergency. Each rule builds upon the last, forming a crucial chain of survival. Remember, the primary goal of CPR is to maintain the flow of oxygenated blood to the brain and other vital organs until advanced medical treatment can restore a normal heart rhythm. Your quick thinking and correct actions can literally be the difference between life and death, providing a bridge of survival. I strongly encourage everyone watching to not just learn these steps intellectually, but to consider taking a certified hands-on CPR and AED course in your community. Practicing on mannequins and getting feedback from an instructor builds muscle memory and confidence that you just can't get from watching a video alone, even one as informative as this. These courses often cover child and infant CPR as well, which have some key differences. Being prepared means not only knowing what to do, but feeling confident enough to actually do it when the moment arrives. It's a skill that, once learned, stays with you for life, and it's one of the most valuable gifts you can offer another human being. Remember, these 5 golden rules can make all the difference in an emergency. Stay informed, stay prepared, and you could save a life. Thanks for watching, and don't forget to like and subscribe for more life-saving tips. Share this video with your friends and family too. The more people who know CPR, the safer our communities become. Until next time, stay safe and be well.